Yes, as part of our contribution to World Cervical Cancer Awareness Day, we are going to be sharing the screening options for cervical cancer, especially those of them that are available in low and middle income countries. Okay. Now, if you are living in low and middle income countries like Nigeria, you have access to screening for cervical cancer methods. Number one is pap smear. Pap smear is one of the methods. Okay. Then the other method is human papillomavirus screening test. Is a test for DNA of human papillomavirus. All right, it's also done. And then the other one is where you have visual inspection with acetic acid, visual inspection with glucose iodine. Then you also have colposcopy. All right. So these are some of the screening methods available. And then you also have lipid-based cytology screening method as well. Okay. So these are the various options. Who are those people who are supposed to, go for screening? Number one, if you're up to 25 years and above, you're eligible for screening, irrespective, provided you still have your cervix intact. All right. What I mean by that is, if your womb has not been removed, you're eligible for cervical cancer screening, and this is essential because individuals who go for cervical cancer screening could be who have access to detection of what we call pre-malignant lesions. Pre-malignant lesions are those stages of involvement of the cervical cancer. It is not cervical cancer per se, but pre-conditions or pre-development conditions which can be detected and treated before cervical cancer develops. This is why it is very, very essential that every woman who is sexually active and up to 25 years, begins to have this screening. All right. It is also an intervention that is very, very effective because it can be treated. Once you are detected to have those early pre-malignant lesions, you can be treated and you will be cured from. Now, one of those pre-malignant lesions you may see, assuming what is popular in Nigeria and other low and middle income countries, is pap smear. Pap smear is simple and has been shown to reduce the risk of dying from cervical cancer by 50% for anybody who does one of it. That's what was done in developed country and it showed this result. So it is also believed that this can also be done in low and middle income countries and it will show similar results. So we are encouraging women as much as possible to take up this program in order to reduce maternal death. So we are encouraging women, if you don't have access to human papillomavirus screening, which is a little bit more expensive, you should have access to pap smear. Pap smear is just taking of sample from the cervix, and then sending it for cytological assessment, and then those pre-malignant signs could be detected in those cells, and once they are detected, you'll be treated. You have various treatments which I'm going to be talking about in the subsequent days, the following days. All right. So we are encouraging women to take up cervical cancer screening. So apart from pap smear, you can do human papillomavirus screening, which is HPV DNA detection. Those samples that will be taken from the cervix, they will also can be used to run human papillomavirus DNA tests to find out if there is presence of the virus in the cervix. Because this virus, human papillomavirus or HPV virus, is what actually stays in the cervix to transform it into cancer. So once it can be detected, the individual, could be followed up and then treatment offered. Once those changes appear in the cervix, the individual can be treated. All right. Now, the one we call visual inspection with acetic acid, you just lie down and then acetic acid will be applied on the cervix. And then there is what you call the white areas. Once we detect that, we can treat the individual. All right. Once we treat the individual, those are the white areas that will appear, and then we'll treat the individual, and the person will be cured. Right. Now, the other one, visual inspection with glucose iodine, the same principle as in visual inspection with acetic acid. Once we apply glucose iodine, you will see some abnormal changes, and then we'll treat the individual immediately, and the person will be cured. Right. The same thing applies to colposcopy. We'll put you down and use a magnifying lens that mounted on a mobile machine to be able to look at the cervix with the assistance of those both acetic acid and glucose. We look at the cervix, and once we see these changes, we treat you. So it's as simple as that. So we are encouraging all women, as long as you're up to 25 years and you are sexually active and you still have your cervix intact, you are eligible for this. And once you start it, I'll be telling you for pap smear how often you'll be doing that until you get to age of 65. Provided your results will maintain negative status, you keep on doing it until you get to age of 65. Once you get to age of 65, you don't need it again. All right. So that is what I have for you today. Share this message. In the next series, I'll be talking about each of these screening methods. I will talk about pap smear in details. I will talk about human papillomavirus screening details, and then I will go down to tell you the treatment options. Assuming we do human pap smear and something is detected, what treatment are we going to offer you? I will discuss that as well. So cheers, always pop in to check up on me to find out if I've dropped new information. All right, so cheers and take care of yourself.